Okay, we are back after a short break. Senate Health and Welfare, and our next agenda item is to look at some of the reports that we have received or will be receiving into committee. And we have our two Ledge Council folk here, Katie McClin and Jen Carby, and thank you for being here. We have the document that you've posted on our webpage for us. And I guess my comment is, and I'm going to turn it right over to you, is for the committee, just to get an idea of what each report is as Jen and Katie go through, and then we'll try to identify those reports that will inform us about the bills that we're looking at or things that we need to look at and take a step further. So it's back to you, Jen and Katie.
Great. Well, nice to be here. Jennifer Carby from the Office of Legislative Counsel.
Katie McClin, Office of Legislative Counsel.
Do you want us to put the list up on the screen as we go through it?
I think that's helpful for folks who are out on YouTube. Not everyone's going to pull up the page.
All right. So can you see the list now?
Yes.
Great. And these should all be live links. So everything that is in blue is a live link, and we've been updating the list as the reports come in. So you may remember that we went through a list like this with you last year. It's really an overview of the reports, as the chair said, that have come in or will be coming in. And we've actually gone a little bit further back. I put one in from May just because it came in right at the end of the session, and I wasn't sure if people had had an opportunity to look at it. And we also added some in at the end that are coming in later years, a few of them, but just wanted to have them on your radar so that when you're working on similar issues this year, you're remembering what's coming to you from things you've asked for in the past. So dive in. The first one on here is a proposed process for developing the Vermont Action Plan for Aging Well. This is something that was in the Older Vermonters Act in 2020. And so this is not actually the plan itself. It is a proposed process you asked the Secretary of Administration to put together, and that was submitted for how they propose to develop that action plan. The action plan itself is to be focused on establishing and maintaining an age-friendly state for all Vermonters. And it also was required to include a review of Medicaid rates to home and community-based service providers. So the proposed process itself is what is available through that link. The next report is the quarterly Choices for Care report. So you'll see these come up a few times because we've got links to each one. And this is a quarterly report on the funds and expenditures in the Choices for Care program for the previous quarter. The next one I believe you looked at yesterday in detail with Ina Backus. This is the Healthcare Workforce Development Strategic Plan. And you had directed the Director of Healthcare Reform in the Agency of Human Services to make that plan available. Next is another quarterly report on Medicaid program enrollment and expenditures. These are the numbers, both financial and caseload. The next one is deaths and hospice care. This is a actually biennial reports every other year. And it is a report from the health department on deaths in Vermont in various settings, home setting, hospital, long-term care facility, other settings for the previous 2 calendar years, and also gives an update on the use of hospice within the 30 days preceding death for those deaths. So keeping an eye on hospice usage. And the next report is an annual report on the receipts, expenditures, and balances in the Health Information Technology Fund. So this is the fund that is supported by a 0.199% tax on health insurance claims. So the claims tax, a portion of that claims tax goes into the Health IT Fund. And this talks about what came in and how the money was spent and what the balances are. Now I'm going to stop talking and let Katie do some of the ones. We're covering the ones that, for the most part, that we drafted the legislation for. So that's the method behind who says what.
So the next report is an annual report about the General Assistance Program, and this is evaluation of general assistance during the past fiscal year, recommendations for program changes, and statewide statistics about the program. That's followed by the Mental Health Crisis Services and Data Collection Report. This report is a one-time report, and it contains strategies for collecting data related to persons accessing emergency services related to mental health crises.
The next report is an update report from the Green Mountain Care Board on hospital sustainability planning. I believe the final report is due in the next week or so. And I think you're going to be hearing more about
Just
hospital
a comment on that. There was a request to extend the date for that, and I believe that will extend into February. So
Thank you.
Yeah,
could not keep track of the extensions.
Well, it's you know, it's
legislation.
Yeah, it's been ongoing request. So
the next report is the proposed use of the Child Care Development Block Grant and the Arpa Stabilization grants. This was due to the Joint Fiscal Committee earlier this fall, and this is one of the reports that was part of Act 45, the Child Care Bill, and it's one of the reports we touched on this morning.
Next is the annual bill back report. This comes in from the Green Mountain Care Board, and I think there has been a role for the Department of Financial Regulation, but may not be going forward. And this is a report on how much they actually billed back to the regulated industries for the costs of their regulation. So there is authorization and in statute for the Green Mountain Care Board to bill back actual costs for certain regulatory expenditures, and then to do another 60-40 industry state split for other costs, and looks at how they actually did that, given that the statute gives them discretion, some discretion. So the next report is an annual report from Dale on calculation and allocation of the savings in the Choices for Care program. And this came into the I think to the Joint Fiscal Committee in the fall. And I know there was some conversation about this topic yesterday in the Human Services Committee. So there is maybe some discussion in the budget adjustment context on this particular proposal. Next, we have clinical prior authorization requirements in the Medicaid program. And this is something that you directed the Department of Vermont Health Access, DVA, to report on how they use prior authorization in the Medicaid program and whether there might be opportunities to reduce some of those prior authorization requirements.
Next is a report in last year's budget on the appropriation to expand high quality mental health and substance use disorder treatment professionals. This was money that was appropriated to the DAs and the SSAs for loan repayment and tuition assistance. And this is a report back on how that money was used.
And actually, that one I think is a quarterly report until the money has been fully spent. Next one is an annual report from the Agency of Human Services on global commitment investments. So this is the money that the Vermont is allowed to use on what would otherwise be ineligible expenditures under the Medicaid program, but our global commitment waiver allows us to use that money for additional investments. And this is the annual report on those global commitment investments. This is the one, if you remember, it is in very small type on a very large page. That's how I keep track of it. The next one is also an annual report from the Department of Vermont Health Access on its pharmacy best practices and cost control program. This is how how utilization occurred in the pharmacy program, prescription drug benefits, and also use of Medicaid authority for supplemental rebates and things like that.
The next two reports are reports coming in from DCF. They were both required by this year's budget. The first is the Specialized Child Care Transportation Report, and that outlines the outcome of statewide transportation, the RFP regarding transportation services for children. And it also has reporting requirements on the number of children served. And then the next report, the General Assistance Emergency Housing Report, it contains recommendations on the development of a sustainable long-term plan for emergency housing. So that came in on November 1st of last year, excuse me.
Next is the next quarterly report on the Choices for Care program.
And then the next report is the annual report of the Child Fatality Review Team. This is findings and recommendations, and it's submitted by the Department of Health.
The next one is a report that was required before some of you were on this committee. It is a report on the utilization impact of limiting the co-payments for chiropractic and physical therapy services. So in legislation in 2018 and then amended a bit in 2019, the legislature enacted a copay limit of between 125 and 150% of the primary care provider copay for chiropractic and physical therapy services. And there had been some discussion at the time about what the potential impact might be on utilization of those services. So this is a report that is providing answers to those questions, at least in the years since, about what utilization has looked like since those copayment limits were effective. The next is another quarterly report on the Medicaid program, its enrollment and expenditures. Next is an annual report on prescription drug cost transparency from the Office of the Attorney General. This is looking at the drugs that had in Medicaid and in the Blue Cross and MVP plans, the drugs that experienced the greatest price increase, either or very large price increase, either over the previous year or a larger increase over 5 years. And looking into some of the potential causes of that.
But there's nothing in that legislation that allowed for action on the part of anyone. It's just a reporting.
It is report. There was as the language is written, the Office of the Attorney General is supposed to go follow up with the manufacturers and get information from them, and that has run into some hurdles in the execution. So at this point, it is more informational than anything.
Informational than regulatory or actionable.
Yes.
Okay.
Next one you've heard about this week. This is the facilitation of interstate practice of healthcare professionals using telehealth, the working groups report and recommendations. And I know we'll be coming back to that topic with this committee next week.
And next is the progress report of the Mental Health Integration Council. That council looks at the integration of mental health into the healthcare system, and that came in last month. And then at the top of page 3 is the Community Residential Facilities and Statewide Bed Needs Assessment. This report reviews the RFP responses and has a bed needs assessment, and it also has a summary of the steering committee group's input on the RFPs that came in. Following that is the annual report of the Emergency Medical Services Advisory Committee that came in on January 1st. And then an annual report of the Marijuana for Symptom Relief. And this is going to be the last report as this section is repealed March of this year. Following that is the report of the
Katie, just real quickly on the Marijuana for Symptom Relief report. One of the things I'm hearing about right now, and this is not something to discuss at this point, but it's a heads up for the committee as well as you, and that is that I'm hearing that there are some changes being made to the use of medical marijuana, and that those changes are being made. I don't know. I think the bill is in judiciary, but I would like at some point for the committee to have a discussion about the medical marijuana as a medical issue, and that we should be weighing in on some of the changes that might be suggested when marijuana is used for symptom relief. That's all. Just a heads up.
Okay, and it would be Michelle who would probably come in to walk you through that conversation.
Thank you. Okay.
The next report is the report of Substance Misuse Prevention Oversight and Advisory Council. If you remember, this council was created maybe 3 or 4 years ago at this point. And this report looks at the measurable goals of prevention programming and evaluation of state-funded programs. And again, this is an annual report. It came in January 1st of this year.
The next report, and you can see these as we're getting onto this page, we're into some that are not in blue. That means the report is not yet posted on the legislature's reports page, which likely means it has not yet come in. So this one is the annual report from the Office of the Healthcare Advocate. The next one is a notice of introduction of new high-cost prescription drugs. So the same law enacted a few years ago that required the prescription drug price transparency report also required manufacturers to provide notice to the Office of the Attorney General when they are introducing a new high-cost prescription drug to the market. And so I've provided a link here, which is that it's the most current link I found on their website, but it is not required to be submitted to the legislature. It's just required to be posted on the Attorney General's website. And you can go there and see notices from a number of manufacturers of new drugs they're bringing to the market.
The next report is a report of the Advisory Council on Child Poverty and Strength.
Not quite.
I'm sorry.
That's all right. The next report is an annual report on the impact of prescription drug costs on health insurance premiums. That's a report from the Green Mountain Care Board. And while it's due on January 1st, I know last year's report wasn't submitted until I think June because of a delay in getting some data. And I think just general COVID related issues affecting state government. So I'm not sure if this one is to be expected in January or if there will be a delay on this one as well.
Now the next report is the Advisory Council on Child Poverty and Strengthening Families. This is an annual report, but you likely will not be receiving it this year because the Advisory Council did not meet in 2021. The next report is an inventory and evaluation of the. Oh, yep.
Sorry, I was waiting for you to take a breath, but you never breathed. Why did that council not meet in 2021?
I couldn't tell you why. No meetings were scheduled. It was not a group that convened during that time. I would probably refer you to the chairs of that committee. Would be my best source of information for you.
Is it a legislative committee or is it
it's a hybrid committee. So there are 6 legislators, I believe, who serve on it, 3 from the House and 3 from the Senate. And then there are members that represent various groups. So I'm kind of thinking off the top of my head, but I think about 10 to 12 members total.
We'll see what's what with the advisory council. It may be that other work has taken over what they're doing. So we can look at that.
Okay.
Okay. The next report is the inventory and evaluation of the mental health services provided by the entity that DOC contracts with for healthcare services. This is actually a bill that you did not have custody over, but you did pull it in from Senate Judiciary to take some testimony and review various reporting requirements. So this is one of the reporting requirements that this committee looked at. And that was due January 1st. The next report is the appropriation to expand high quality mental health and substance use disorder treatment professionals. This again is a quarterly report that we already went over on page 1. Next is an annual report. It's the inventory of AHS grants. And that's followed by an annual report from the Commission on Alzheimer's disease and related disorders. This is the findings and recommendations of the Commission's work each year.
Next, we have the Human Services Board annual report. And I did go back and look at last year's report, which said that they had transitioned to a new case management system in October of 2020. And so they were expecting to be providing much more complete reporting, starting with the report coming in this year. So I just wanted to flag that for you, that report may have more of the information that is requested in the statute.
The next report is from the big health equity bill that you worked on last year, Act 33. So if you remember, the act established the Health Equity Advisory Commission and required an annual report from the commission. So that's this report, but you might not remember that there was also a session law requirement that certain topics would be covered in the first annual report of the commission. So those topics in the 2022 report only included FY23 budget recommendations. In particular, the Office of Health Equity, the statute says that it's to be in place by January 1, 2023. So budget recommendations specific to setting up that office. Also inclusive definitions and recommendations for the use of ARPA funds.
And just to insert here, did you want to, is that the end of your?
I think you're going to say that this has been delayed or an extension has been granted on this particular report.
I am, and we met, Bill, Representative Lippert and I met with Susanna Davis about the report. It came up during our task force on affordable, accessible healthcare because one of our charges is on equity, health equity. And so then we met with Susanna Davis, and her request of us as chairs of two committees was to extend the timeline for the report. And we did that. And I have another meeting with Susanna coming up, so we'll see where that is. Thank you. That's it.
Okay. The next report is also from the same act, Act 33, the analysis of health equity data. So this is an annual report that the health department is required to submit. And this breaks down health equity data by different categories, race, gender. And so that will be coming to you every year. You've already received it. The next report is the report of the Maternal Mortality Review Panel. This is an annual report with statistics, findings, recommendations. And then lead poisoning prevention in young children. Again, this is an annual report. It contains information about the number of children screened, barriers to universal blood screening, and recommendations to prevent lead poisoning in young children.
The next report is not one that we expect to come in yet, but it's on here to remind you that once the wholesale prescription drug importation program becomes operational, there is an annual report requirement. So no report due yet because the program has not been stood up, but if and when it is, there will be an annual report on that. The next report is concerning the use of the patient choice at end of life law. So that is the law that we talked about in the context of S74 yesterday with Senator McCormick. And so this is a biennial report every 2 years on how that numbers on how that law was used and the medical conditions that people were experiencing that led to their use of either receipt of a prescription and or use of the medication.
Yeah, this is one that we may like to invite the Department of Health in to present some data before we finish our work on S74.
The next report is an annual report submitted by the Department of Mental Health. It discusses the extent to which individuals with a mental health condition or psychiatric disability receive care in the most integrated and least restrictive setting available. And another annual report, Dale submits a report on the implementation of the Developmental Disability Services Plan each year.
Next up, we have the annual report of the Vermont Information Technology Leaders, VITAL, who among other things operate the state's health information exchange. Next, we have the annual report from the Green Mountain Care Board. And as you may remember, there are a number of things that you ask for in there on an annual basis. And then sometimes you've also required things to be presented as part of their annual report. Next, another annual report from the Green Mountain Care Board. This is the healthcare expenditure analysis. So this is looking at both all healthcare spending in Vermont, both on Vermont residents and non-Vermont residents, as well as all healthcare spending on behalf of Vermont residents wherever that care occurred. So lots of information in this report and a number of other things as well, but that's one thing, and some comparisons to national data.
5 or 6 years ago, you created the Deaf, Hard of Hearing and Deafblind Advisory Council. And under statute, they're required to submit an annual report with their findings and recommendations.
Next, we have the annual report of the Clinical Utilization Review Board. This comes in from the Department of Vermont Health Access. And the Clinical Utilization Review Board was set up a number of years ago, I think around the time of Challenges for Change. Their role is to make recommendations to DVA on the appropriate scope of coverage, limitations, place of service, and appropriate medical necessity in the Medicaid program. And then the commissioner of DVA reports in this annual report on the board's success in improving clinical and utilization results. So talk about both what the Clinical Utilization Review Board has been doing, and then the commissioner's take on results attributable to that work.
The next report is an annual report from DCF on the distribution and use of supplemental childcare grants. This is separate from the work that you did last year on childcare grants. This is an ongoing annual report. The supplemental grants, there's criteria and statute as to how these grants are distributed, and they go to providers that meet the criteria, and much of the criteria has to do with providers that serve underserved populations.
The next report may not actually be one to expect this year, but I put it on here in case and to keep it on our radar for next year. This report on the state plan on aging implementation is or will be an annual report from Dale. This has to do, the state plan on aging is a plan that has to be adopted every 4 years pursuant to the Federal Older Americans Act. But when you enacted this particular requirement 2 years ago in 2020 in that Older Vermonters Act, it specified that this report requirement applies to the plan that takes effect in October of this year. So I'm not sure if they will be reporting on implementation, or maybe they will be reporting on their efforts to stand up the new plan, but was not sure if we should really expect this plan in or not, this report. The next report is an annual report from the Vulnerable Adult Fatality Review Team. Similar to some of the other teams at reports in here, this is looking at, they dive into the details of a few of the deaths of vulnerable adults in the past year, and look at both what occurred and what prevention measures could be taken to prevent similar deaths in the future. Next is an annual report from the State Long-Term Care Ombudsman on complaints, conditions, and care in Vermont's long-term care facilities. And we're right in the middle of a whole bunch of these reports that are all due on the 15th. So a little over a week from now.
The next two reports can be kind of addressed together. They both deal with the administration of involuntary non-emergency psychiatric medications. They're both annual reports. One report is done by DMH each year, and one report is done by an independent consultant each year. So those are the next two reports on your list. The report after that is the Homelessness Emergency Shelter Grants and Management Report. This is a baseline to measure results of investment in emergency shelter grants and case management. And as you'll note, this isn't a written report, but it is part of the annual budget presentation from AHS. The following report is the Substance Abuse Treatment Services Delivery Program Success Report. This looks at the success in reaching program objectives, and it comes in from AHS, the Department of Health, and DVA. So it's a collaborative report that comes in each year.
Next, we have a report on the payment and delivery system reform for Medicaid services and providers, what is sometimes referred to as Medicaid Pathways. And this is looking at integrating all Medicaid service, all providers in the Medicaid program into the healthcare payment and delivery system reform, particularly in the context of the all-payer model.
The next report is data on patients seeking mental health care in hospital settings. This was set to expire last year, but you extended it until 2023. So you have this coming in for a few more years. And the legislation last year also narrowed the scope of some of the data that was being collected through this report. The top of page 6. There's a report to update the progress in addressing the CMS requirement to reduce federal Medicaid spending on institutions of mental disease. This is an annual report that will come in through 2025 from AHS.
The next two reports are from 2020 Act, where you're looking a lot at prior authorization requests. And so the first one is from the Department of Financial Regulation. It is looking at opportunities to increase the use of real-time decision support tools embedded in electronic health records for prior authorization requests for imaging and pharmacy services. So that report is also due on the 15th. And then the following one is looking at prior authorization requirements and the all-payer model. And this is the Green Mountain Care Board, but it's really a whole group of stakeholders looking at opportunities and obstacles to reducing prior authorization requests under the all-payer model, and also looking at other potential opportunities to reduce Medicare administrative requirements that may be waived under Medicare as a result of our participation or their participation in our all-payer model.
The next report is an evaluation coming in from DPS on the effort to embed mental health clinicians in police barracks.
Then we have the annual report of the Adult Protective Services Program, which is under the Department of Disabilities, Aging, and Independent Living. Following that, this is really for inclusion in the Agency of Human Services fiscal year 23 budget presentation, but estimating the costs for fiscal year 23 of providing what we called Dr. Dinosaur-like coverage to children and pregnant individuals, regardless of their immigration status.
The next report is also from Act 57. So again, this is...
Sorry to interrupt again, Katie. I was trying to get unmuted for Jen. On that last one, that's supposed to be part of their budget presentation. I don't know if Senator Lyons or Jen, if you've heard, but I've heard that there's been some bumps in the road in implementing this program, and wondered if you know more information or if they're going to come in and give us testimony on where we're at with this.
Well, let's wait until the report comes in. And then it is part of the budget presentation. So as we move into budget mode and looking at funding and ongoing, then we can decide to pick this up. Yeah, I've heard the same thing, but I don't think this is the time to take it up in the committee, but we certainly can keep this on our radar.
Yeah, I just want to flag it. I didn't mean to have a long
that's good.
conversation, but it seems I've heard some problems and want to make sure that, given all the work we put into it and the importance of it, that it gets moving forward.
It will. We'll do that, but we'll wait until the time is right.
Okay. So the next report is from Act 57. Act 57, again, is the same act I mentioned before that you didn't have custody over, but you did spend some time looking at some of the reporting requirements. So this particular group, the Forensic Care Working Group, is going to be submitting a preliminary report and also a final report. And it looks at the treatment of persons who are found not competent to stand trial And it also looks at whether there's a need for a facility. That's just one part of that report, but that is an aspect that the Senate in particular had an interest in.
Yeah, when we get that report, that's something, and not when we get the report, but it's something that may inform some of the bills that we're looking at, the work.
So the next three reports all come from last year's budget bill. The first one, which the chair is very familiar with, is the final report of the task force on affordable, accessible healthcare. That was a task force that this committee worked on a lot and has been meeting throughout the summer and fall, and will be presenting its final report in the next couple of weeks. There's also was a requirement for the Department of Financial Regulation to conduct a review of Vermont's benchmark plan that establishes the essential health benefits. So looking at the benchmark insurance plan comprises the essential health benefit package for our qualified health benefit plans. Specifically, they were directed to look at whether the benchmark plan is appropriately aligned with Vermont's healthcare reform goals regarding population health and prevention, and also to determine whether to seek approval from the Centers for Medicare and Medicaid Services to modify the benchmark plan to include, and then there was a list of particular coverage types and other benefits that this committee had a big role in contributing to. And so that report is originally due on the 15th. They have requested a slight extension to, I believe, the 20th.
Right.
So January 20th is when to expect that report. The
So,
next
and
one,
just a short comment on that report. I'm actually looking forward to it. I think there'll be some things in there that are very, that we'll be pleased about. Because I know we've had an interest in some of in changing the benchmark plan for different age groups and so on. So I did have an opportunity to meet with folks as the report was being finalized, and so we'll look at that when it gets to us. We'll see what stage it's in, or at least we'll look at it as we put some of the language into legislation or next steps if needed.
the next report is also from the Department of Financial Regulation, and it is on looking at national issues affecting participation in the 340B drug pricing program. And this is actually DFR in consultation with the Office of the Attorney General. And this committee may remember these 340B issues came up at the very end of the session, and there was some concern about emerging national practices. So this is, there were two parts of that. One part was to put some provisions in place through January of next year that you may be looking to revisit around PBMs and pharmacies. And the other part was to have DFR and the Attorney General's office take a closer look at what was going on and report back. And that's what this report is.
The next report is an annual report that comes in from the Agency of Education and DCF, and it evaluates pre-kindergarten programs, including how many children are served and the providers that are serving them, whether they be public providers or private providers. That's followed by the report of the Emergency Service Provider Wellness Commission. So this was the commission that this committee, you worked on it 2 years ago, but it was finally passed in the House last year, I believe. And this is an annual report, but as you'll note, the statute doesn't specify when the report comes in. It just comes in once a year.
That was the commission that went beyond the end of the alphabet, I think.
It sure did.
All right, the next report is the annual report on the Blueprint for Health. That is due at the end of the month.
You also receive an evaluation of the Reach Up program each year from DCF, due at the end of the month.
I think the House Human Services is beginning work on Reach Up, so they may be looking at that before we do.
And you have a time-limited report, annual report to expect. I believe this is the last one that you'll be receiving. That's on the prior authorization for MAT and Medicaid. And that report includes which medications require prior authorization, how many prior prior authorization requests were received, how many requests were approved, and the wait times to process the requests.
Next is a price transparency dashboard demonstration from the Green Mountain Care Board and recommendations about that. And this was from a couple of years ago. This is a requirement for, and I think they were already working on it, but for the board to develop and maintain a public, interactive, internet-based price transparency dashboard that would allow consumers to compare prices for healthcare, certain healthcare services from different providers and settings around the state. And so they are due to give you a demonstration by February 1st, and then also to make recommendations on ways that they might want to expand or change the way that works for future iterations.
And then you have another report from this Act 57 that you never actually had custody over, but weighed in on. And this report entails the necessity of notification to a prosecutor if a person is not complying with an order of non-hospitalization, and also a progress report from the forensic working group with regard to the study of models for forensic treatment. So this particular report is more specific to facilities, and that's coming in February 15th.
And then we get to a section that we've called future reports that are coming in after the session ends. And in some cases, well after, a couple of years after, but we wanted to make sure that these were still on your radar, both so that you are aware of what you have already asked for, and also just to help us make sure we're including everything in next year's list. So just wanted to flag these for you. The first is a report of the Self-Neglect Working Group. This was a working group that you created in the Older Vermonters Act in 2020, and their report is due by July 1st.
And then you have several items on this list from Act 45 of last year, the Child Care Act, and we went through most of these this morning. But you have the costs and implications of enrollment-based model for CCFAP versus the attendance-based. That's coming in on July 1. You have the Child Care and Early Childhood Education Systems Analysis that's coming in on July 1. Again, that's the consultant that's hired by Building Bright Futures is completing that report. Then on August 1st, you have the final report of the Forensic Care Working Group. That was the final report for Act 57. Transitioning to the bill, the Health Equity Bill, there are recommendations coming for improving cultural competency, cultural humility, and anti-racism in the healthcare system. That is due on October 1st of this year.
Just as you're talking about that, it seems to me that we need to have that same language for the judicial system, the educational system, the financial system. Needs to be pretty ubiquitous. Anyway, go ahead. Sorry.
The next two reports are also from the Child Care Bill. So it's the financing study. You have a preliminary report and then a final report coming. So the preliminary report is December 1st of this year. And then next January 15th, you get the final report of the Child Care Financing Study. And then you have the Mental Health Integration Council. The final report is also coming in next January.
This next report, final one on this page, is a report that is due at the end of 2023 on the delivery of healthcare services by audio-only telephone in 2022. I just wanted to remind you of this because the way you had set it up last year was to require health insurance coverage of services delivered by audio-only telephone, and then to use the 22 plan year to collect data on utilization, quality, patient satisfaction, et cetera, and come back and look at that in the 2024 session, with this report being due by December 1st of 2023, so that the claims tail will have finished out sometime in early 2023 or earlier mid 2023, and they'll have time to look at the data and then produce the report.
So, and on that one, when we had testimony around Act 6 and the telemedicine last week, we heard that the recommendation from folks was that audio only should be treated all telemedicine delivery should be treated the same. And so the question arises about the current reimbursement rate that's being recommended through the DFR about the 75% for audio only. And I think that's, I'm concerned about that because it will change the data that we get. So we might want to have a conversation about that one going forward.
Yeah, you may want to understand what
Yep.
that looks like. I think the recommendation, particularly around treating all telehealth the same, was more related to the licensure issue from OPR.
Oh, that's
they
true.
thought that the license
You're
would
right.
apply
Yeah, you're true.
regardless of modality. But there was certainly talk about DFR. You had given DFR the authority to set the reimbursement rates for plan years 22, 23, and 24. And they have set it at, they require plans to pay at least 75% of the in-person reimbursement rate. That's what they've set for 2022. Right. And they may set something different for 23 and 24. I don't know.
Yeah, we may come back to that. We'll see how that goes.
And that brings us to page 8 with the last two reports. They're both child care reports. The first is the evaluation of effectiveness of certain child care related programs and expenditures in the FY20 Budget Act. So this, if you remember, this was sort of you had a standalone bill that you had been working on, and then it ended up, most of the provisions of that bill ended up in the budget that year. And this was kind of the beginning of the 5-year CCFAP transition. So this is a report due in 2024 on those budget provisions. And then lastly, a report that we talked about this morning from Act 45, and this is the evaluation of the early childhood workforce programs. This is the current and prospective programs for providers and also the tuition assistance program for providers. 2 of those 3 are set to expire before they are repealed or before the repeal takes effect. There's a report due in 2025 to analyze the success of those programs. And that's it.
That's all.
A little bit of light reading.
Well, but honestly, we've asked for an awful lot of information, but it all does feed into the work that we're doing. So if you look at the forensic facility or voluntary, involuntary treatment, they will flow together with our discussion on mental health and the work that institutions and judiciary has been doing with their with youthful violent offenders versus the nonviolent group. So there are a lot of things that we have put in place that I think will be useful to us. And some of those we've identified going through, and others we'll pick out as we look at the reports that are coming in.
And Katie and I will try to work with Aaron to keep the list updated as reports come in to add the live links in there. The document is posted under your reports, additional page, one of the tabs on your website. And so we will work to keep that updated. Reports and resources tab. We'll work to keep that updated so that you can easily access the reports as they come in.
So I know you have a question, Senator Hardy. I'm just going to say, before we get to questions, my suggestion is that each of you on a committee go through and identify some reports of interest to you. I'm not going to designate specific reports, but I know that each of us has different interests. Look through some of the reports, and then I'm thinking that the best way to deal with these initially, at least, is as we take up bills and issues that we use those reports to help inform our work. So I know if you have a bill in on mental health, you have a bill in on childcare, or a bill from the Alzheimer's Commission. You might want to look at the reports that relate, and then, or the Older American Act. We can, we'll try to include the recommendations that are there so we understand how they might help us going forward. So take some time and do that. And there are other reports coming in that are very complex, and we'll take some time on some of those. There's one report that's not on this. There's a lot of reports not on this list. As we worked in HROC over the spring and fall, and we worked with a consultant, and we do have a report from that consultant, and I'm putting together some testimony that will help us understand some health reform issues that are currently of concern to a lot of people. So we'll look at that one as well. Senator Hardy.
Thanks. Just a question, Jen, on the report on the review of benchmark planning and establishing essential health benefits. Is that the one that will cover, it was like hearing aids and that list that we came up with? Okay.
Yes, exactly.
Then just a little technical feedback for you guys as you update this list. The links are super helpful, but what happens when you click on the link is it doesn't open a separate tab. So then you lose your place in the whole big list because it opens in the same tab. So this is, it's a really small thing, but if you could make the links, or maybe Erin can work on this to make the links so they open in a separate tab, then you won't, if we're working our way through the list, we won't lose our place on the list. I don't know if I'm explaining it
I
correctly.
think we're going to need an IT consult on that. So I haven't the slightest idea how to make that
I think
happen.
IT will have fun with that request.
It just, if you click on the link, it will just cover up the list and
Right.
open
I
it
know what you're saying.
in the same tab.
And I
Yeah,
have to,
we
I
got
think
it.
if you right click on a link, typically you get an option to open link in new tab.
Right.
So that
Oh,
may
yeah,
be-
you're right. You're right. So that might be the fix. That's easier. But yeah, that was just a feedback. I'm sure Erin can figure that one out, but right clicking is
Well,
also helpful.
Just right click.
I also printed it and highlighted it the old fashioned
wow.
way, but
Good for you. That's due diligence. Oh, okay. Any questions for Katie and Jen? Thank you for putting all of this together. At some point, as we're going through different things, there are some of these reports that all fall together. And so we leave it to you to help us keep ourselves organized about, like, for example, all Act 57 reports or so on, but we don't need that right away. And just as we go through things, make sure we don't forget. That's all. Okay, any other questions, comments, speeches? No, please, no. I think we're good for the day. Thank you. This has been, this has been our first week, and the people I've talked with, I know how you all are feeling. How do you feel after the first week would be an interesting essay. It's very intense. So I appreciate all of the work that you've been doing very much. And we'll continue. Next week, the agenda is up. We're continuing on the bills. S74, I think, is up for some testimony, as is S91. We have the Child Advocate Bill coming in, and a report from the Child Care Oversight Protection Committee. And we're going to try and keep doing this. We're going to try to continue looking at the bills that we've had in the past, and then build some testimony on those bills, and then work toward markup. And because some of these bills we've seen before, there are issues that we're familiar with. So I think we can work efficiently and smoothly to move ahead. There are others that have some budgetary implications, and we're going to seek advice as I make my regular connection with appropriations, what's in and what's out, and how, whether the bill, which parts of the policy sections are in jeopardy and which are not, but we'll continue to do our work. And then, Aaron, I think that we're good and we